we have to think carefully about what antibiotics are most appropriate in conjunction with LED light therapy. We don't want to put them on an antibiotic such as minocycline or doxycycline, which could be a photosensitivity risk when used in conjunction with light therapy. Most acne patients, by the time we see them, have already tried these antibiotics with their GP anyway, and it's not usually an issue, but we'd prefer to be on something like erythromycin, first-line, or trimethoprim in these instances, so that it wouldn't contribute to any problems with the skin used in conjunction with LED. Find out what they're actually doing at home with beauty products. So they'll often have bought a ton of makeups and over-the-counter products that they're confusing their skin with and perhaps clogging their pores up. So get them to throw out everything they've got in the cupboard, because it may actually be making the skin worse. In conjunction with antibiotics, we would prescribe a topical retinoid to be put on at night, introduced gradually and every third night, say, to start with, because it can irritate the skin and cause a retinoid type dermatitis. So we want them to start gradually and increase it, say, every second night after a week, and then every night thereafter. And warn them that it's usual to get a bit of dryness and skin irritation in conjunction with the topical retinoid. An SPF 50 plus every morning is important, and it must have good UVA and UVB protection in conjunction with something that perhaps blocks out the filters from computer screens and things like that, because we're not sure about how much of that is contributing to ageing effects on the skin more than anything else. Make sure they've got a good cleanser. Boys in particular are not good at cleansing their skin. They just use a bit of soap and water. And this is where instruments like the skin scope can be quite handy to look at the skin and assess how well they're cleansing the skin. And it's used as a marker of what progress they're making with their acne treatments along the way too. So they really must be encouraged to get a good foaming cleanser that they use twice a day. Obviously, the thing that we use in conjunction with all those things is LED phototherapy. 415 nanometer blue light is used to kill off bacteria, the P. acnes particularly. It penetrates to that level of the pilosebaceous gland, so that it does enhance that sort of killing off of the P. acnes bacteria. That's used at one end of the week, about 20 minutes on. And then we use a red light LED of 633 nanometers at the other end of the week. And that is usually used to decrease inflammation, improve collagen and minimise scarring. So the combination of those two wavelengths are important to treat in conjunction with your antibiotics, your topical retinoids and your cleansing routine. So it depends on the degree of acne as to whether you'd be using, say, 4 weeks of LED phototherapy prescribed, or sometimes even 6 to 8 weeks in someone who's got severe cystic type acne with a lot of jawline cysts and pustules and nodules perhaps. So it really depends on your assessment of the degree and the severity of the acne as to how many weeks of light therapy we prescribe.